Hello again, Dr. Evan here. Today we're going to talk about a couple of very common procedures. Radiologists typically do these, some other physicians will do them as well. Radiologists do them with what we call imaging guidance. So these procedures are called epidural injections and lumbar punctures. The reason I'm doing them together is they are very similar. The needle that is used for both procedures basically ends up in almost the exact same spot. A lumbar puncture just goes a couple millimeters further. So the main indications for an epidural injection, there are a few. So the first one that most commonly people associate it with is probably pregnancy, and it's used to inject anesthesia during the childbirthing process to help with the pain. Similarly, you can inject steroid into that epidural space to help somebody that has chronic low back pain. And a third indication, which is less common, but if you have a headache that's related to what's called a CSF or cerebrospinal fluid leak, sometimes after a lumbar puncture, you can do something called a blood patch where you inject blood directly into the epidural space. Lumbar punctures, those are more varied. They have a lot of different uses. One of them is diagnostic, to sample the cerebrospinal fluid around the spinal cord. That's done for if somebody thinks you might have meningitis or cancer cells or infection within the fluid. That's a diagnostic lumbar puncture. There are therapeutic lumbar punctures. That's usually done for people that have increased CSF pressure, something called idiopathic intracranial hypertension or pseudotumor cerebri, where a person naturally has too much pressure, so we take some of that fluid off. That's a therapeutic lumbar puncture. And the third thing is you can inject something into that space through a lumbar puncture. So the most common things injected would be contrast, to do a myelogram, which puts contrast around the spinal cord. You get a CT scan and it helps the radiologist look at the spinal cord. That was what was done before MRI was invented. We still do it in some cases when patients can't get an MRI or they have hardware that obscures their spine. The other thing that is commonly injected is chemotherapy, intrathecal chemotherapy. The thecal means thecal sac. That is the sac of fluid around the spinal cord. So I'm going to walk through a video using our software showing an MRI and some artwork that we have to take you step by step through the process of an epidural injection and a lumbar puncture, using imaging to explain exactly where and what we're doing. All right, so let's talk about lumbar punctures and epidural injections. So as I said, I have an MRI over here on the left side of the screen, and I have a model over here. So we're going to talk about both these procedures in tandem because they're very similar. The difference is really just the needle placement, and actually the needle is basically 2 millimeters or so in different spots. So these are very similar procedures. This is a T2 weighted sequence of an MRI here of a lumbar spine. The reason I'm showing this one is it shows right here in the white, this is the cerebrospinal fluid. This is the fluid that goes around our spine and our brain, and this is the fluid that we try to sample in a lumbar puncture. And this sequence shows this really well, so I'm going to use this one. So over here on the right side of the screen, I have a 3D model of a patient. So you can imagine yourself coming in for an epidural injection or a lumbar puncture, and these are going to be done in a similar way. So there are two major positions that you or the patient will get in. And so basically you can either be on your side. So there are two positions that these are normally done in. And the goal is to get into the lower back here. So this is the lumbar spine area. This is what we're looking at here. We're looking at the spine from the side in this MRI. So we're looking at it this way. This is called the sagittal view. But the lumbar puncture is going to be done in this area right in here. And the reason for that is because the spinal cord ends at about what's called L1. So these vertebral bodies have names, L1, 2, 3, 4, 5. And we do not want to hit the spinal cord with a needle. So that's why we go below the level of the spinal cord. There are nerve roots in here, but they float freely in this fluid and they usually move away from the needle. That being said, when the needle goes in there, you may feel some burning sensation or a stinging sensation very briefly in your buttock or down your leg. That's the needle touching one of these nerve roots. That's totally normal, and that happens some of the time. It's just completely random when the needle goes in. So you can lay flat on your stomach like this. For this procedure, that is the most common way. Sometimes we'll have you lay on your side and curl your legs up. That's another way to do it. Either way works. We're just trying to go in the back here. So I have a diagram to show a little bit better of the layers of the spine and where the needle is exactly going. As far as the procedure goes, after you get into position, the physician, the radiologist, the anesthesiologist, whoever is doing it, they will numb up the skin back here. So this is the skin back here. We will numb this up with lidocaine. Lidocaine is the popular anesthetic used for skin numbing. And this typically is what most people consider to be the quote-unquote worst part of the procedure. The lidocaine needle causes about 5 seconds of a burning sensation. It's roughly equivalent to a bee sting in the back of the skin here, and we will numb a little bit down in through here. We cannot numb deeply into here because we don't want to numb any of these nerve roots and things inadvertently. So we numb basically back here. This is where most of the nerve endings are anyway. The procedure is set up as a sterile environment, just like a surgery procedure, and the risks of the procedure are very low. So epidural injections, even less so than lumbar punctures, but the risks are bleeding and infection, way less than 1%. Major bleeding and major infections from these procedures are extremely low, almost near zero. With a lumbar puncture, there's a little bit of a risk for hitting one of these nerve roots, like I said, and that will cause a little bit of pain. And the common side effect of a lumbar puncture is actually a headache. So about 10% of patients will get a headache from the procedure, and about 1% of patients will get a severe headache or a headache that lasts longer than 5 days. If this happens to you, this would be something to bring up with your physician, and actually that is one of the indications for a blood patch, which is one of these epidural injections. So the physician will take a needle, they will numb the skin with lidocaine, and then they take a separate needle, and that needle is going to travel right through the soft tissue, down in through here, and then into either the epidural space or the subarachnoid space where the fluid is. So we have back here the skin, we have muscle, we have ligaments. So this is a ligament on the back of the spinous processes. These are ligaments in through here, the inner spinous ligaments. This is a ligament here, the ligamentum flavum. So the needle is going to go through skin, fat, subcutaneous tissue, this ligament along the spinous processes, this ligament in between the spinous processes, the ligamentum flavum, and then either in one or two spaces here. So this is the epidural space, this is actually fat, and then or into what we call the thecal sac, which is seen here with this maroon color around. So the yellow is actually spinal cord and nerve roots on this diagram, and the maroon is going to be the fluid that is shown in white here. So the needle will either stop here for an epidural injection or go further into here for a lumbar puncture, and the fluid can be taken out, medication can be put in, sometimes chemotherapy is put in, contrast for myelograms can be put in, and then sampling of fluid can come out. In the epidural space, we can put blood, steroid, anesthesia in that epidural space. There is a slight risk with epidural injections of putting too much and causing a little bit of compression, but again, that risk is extremely low. So just to show the needle placement of an epidural injection. So again, this is that epidural space here in this orange color. That's this fat back here. And this is an example of injecting something in that space. So the needle comes all the way through these tissues and it goes right here in this space, and that's basically it. And then for a lumbar puncture, same thing. The needle goes all the way through and goes into this CSF space, so it would stop in this white area here, and then again, you could take out fluid or put things into that space. These are the nerve roots in through here. So that's basically how the procedure goes. It's a pretty straightforward procedure. Most patients tolerate it very well. I mentioned the risks previously, and the benefits are numerous depending upon what you need the procedure for. If a radiologist is doing the procedure, he or she will likely use image guidance, so they'll use x-rays, which is called fluoroscopy. They're basically moving x-rays to see these spaces in between the bones to put the needle. If you're getting it at the bedside or without imaging, they will use palpation, so they'll touch the back of these spinous processes and they'll know where to put the needle based upon that. If you have degenerative changes in your spine, the procedure can be more difficult. If you've had a prior fusion, the procedure can be more difficult. These are things that your physician should know and likely will know, and also makes it more likely that you will need image guidance. So in general, this is how the two procedures are performed. And please reach out to us if you have any questions. Again, I hope you enjoyed the video. I hope you learned something. And as always, please subscribe to our YouTube channel. And if you would like to see us make any videos about anything to do with anything in medicine, please let us know and we will try to do that. And as always, we will try to use imaging to help show what the particular area of medicine is, whether it's a diagnosis or an imaging finding. We're happy to do that. Thanks.